So today we are going to see the IP module of HealthSpark. So the process is first is the patient registration. Here we are going to do the patient registration or IP admission. So first we have to go to this patients tab and we have to go to the registration module. After going to the registration module, here, same as we do in OP, we have to do the patient registration. So, patient's name is Mrs. For example, Mrs. Taskin, age 25 years. Any relation, we can select the relation wife of Anas and mobile number. And same, we have this SSID and UID number. Now once we enter in IP registration, we have to click this inpatient. We have to select inpatient for inpatient or IP registration and save. So here the patient successfully got registered in IPD. Now here in the consultation, who's which doctor's patient is this, who is the consultant, we have to take the consultant and save. So here we'll come to know, okay, this is the consultation or this is the consultant. The very next step is the room allocation to the patient. So first we have to select to the room section here. It means which room we are going to allot to the patient. So we are going to select the room here. So once we select the room, at the right hand side there is a room details button or room button. Once we click on room button, we will get a complete we will get a complete idea like what are the different rooms which are there in our software in our hospital. So once I clicked on room, here we got to know at first floor we are having isolation ward. At first floor we are having labor room, medical ward, NICU, operation theater. We are having PICU. Now in the second floor we are having general ward, paying rooms and PTU, POW, semi-private ward. Then again we are in the ground floor we are having emergency room. Now we'll go to first floor. Here you can select the, or we can go to select the second floor. In second floor we are having general ward. Here there are bed number 1, 2, 3, 4. The system will give you an idea, okay, on which number the patient is admitted. So whichever bed number we are allotting to the patient, that we have to select that we have to select here, so that we can add the patient in the room. So now I am going to select this bed number 2. Bed number 1 is already allotted to the patient. You can see general ward bed number 1 is Mrs. Sana. IP number is their registration date, age and mobile number. Next is the bed number 2 we are selecting. So we can select. Now what we can do? We can now take the package amount. Okay, for example 15,000 is the package amount, so we will enter 15,000 or whatever the amount is giving as the advance. For example, the patient is giving as 5,000 advance, we had to save. Here we'll get an idea, okay, this is the inpatient advance amount 5,000 rupees. After this, the same patient we are applying some services like nursing charges, or like we are having blood transfusion charges, or we are having epidural charges. So all these services which are added in the master service master, we can add here. So in the same way we'll get an idea, okay, what are the different processes we have, services we can add to the patient. So this is just the basic patient IPD registration. After that, selection of the consultant. After that, we are going to allot the room, selecting the floor. After allotting the room, we are going to allot the services. The very next, the same thing. For example, if you are in a nursing station, here you can see we are able to see two people in the nursing station, two patients. So in nursing station, we can see Mrs. Sana and Mrs. Taskin. So if I select on Mrs. Taskin patient, we can see the go to rooms and we can see, because this room was applied in registration or the IP billing counter. The same room we can see to the same patient in the nursing station module. Whoever are using a nursing, they will get the nursing module. Here they can check, okay, yes, here this patient we have allotted in the billing general ward at this time, bed number 2, we can select. So now after this, for example, we want to give some, like we want to do some advice or any nursing notes, monitoring. Okay, we want to put, or we want to put the vitals at each and every time. We can enter the vitals of the patient and save. We can enter the, for example, I'm entering on a dummy basis. Okay, respiratory rate, temperature, O2 concentration, GRBS, and we can save. Okay, so here, so first, once you go to nursing station, you will get the same details. Now, if you want to get the detailed bill of the same patient, we'll go to discharge and we can select the same patient, Mrs. Tuskin. Here we can get the summary. For example, you want to give any summary to the patient. For example, discharge summary or pediatrics new. Okay, if the case is of pediatrics, no, or if the case is of SVD, we'll get the we'll get the complete details here of the we'll get the complete details of the discharge summary. We can change the details and save. It gets saved. Okay, so these are the things which we can do. So after that, if I just change and save, it gets saved. If I go to discharge and just select on this print, we'll get the complete discharge summary. Again, at the same time, we want to get the bills. Here we can select the final bill and click on PDF. A final bill will get downloaded like this. I'll show one more bill. This is the one more bill. Here we'll get the complete things. Okay, what are the different things applied to the patient? Whether it is accommodation, it is consultation, whether it is services, each and everything will come here. I will also add some services here, because the services in the registration nursing or epidural charges, we have this blood transfusion charges, and I'll just save. So once we go to nursing station, we can see all the services applied. Can you see here? All the nursing services which we gave, this will be there. Okay. Even in the discharge also, we can come and select to the patient, and in the summary, in the discharge final bill, we can check. So here we'll get a complete idea. We can check here the services. Okay. Okay. We can check the services also. Okay, what are the different services, accommodations to the patient? Okay, relationship. Okay, accommodation, consultation, services, everything. Even at the same time, for example, in the nursing station, we can go to the same patient. We are giving some, we are applying some tests. Okay, what is the test name? For example, CPP. Okay, we can save. And at the same time, for example, LFT is the test we are given, we can say the same thing. Once we go to discharge, we can just select the patient, go to discharge, select on editable bills, click on PDF. We can just come and check. Okay, yes, here these are the investigations which are applied. So here we can get a complete idea. Okay, these are the different things which are applied to the patient. In this final bill we can get the details. So here what we have learned, first is the patient registration in the IPD, then consultant doctor selection, then the next process is the room allocation. After room allocation we'll come to the nursing station. We can apply any services investigations to the patient. The patient can be able to, the nursing person can be able to add the investigation, the services. And coming to the discharge module, we can uh, come and take out the discharge summary. After taking the discharge summary, we can also take out the final bill, which will give up all the breakups. Now again, for the same patient in the IPD, we have to take some advance amount. For example, again we are going to take 4,000 advance amount. Take advance amount, enter the amount and click on save. So here we will get the complete advance. Here we can check the complete amount paid, 5,000, 4,000. So this is the complete procedure, which is a very basic procedure which we have to follow in the process. Thank you.